Okay. So we'll discuss LO2, which we had discussed last week. And there was some stuff that you were given to prepare. And so, yeah, starting with this. So we're talking about understanding the values adhered to in service provision. Okay. So there's some key terminologies that we will discuss today. So what is meant by service provision or provision of care values? So these are guiding principles that support you to put the interests of the individual receiving care or support at the center of everything that we do. Okay, so whatever we are doing is all centered around care of the individuals that they're under us. So whenever you're talking about whatever you're doing with them, you're always putting them at the center. Okay. Okay, right. Just letting you know, in between this session, if you need more understanding on anything, please feel free to ask. Okay. So your examples of provision of care values are individuality. So you're enhancing their individuality. You're talking about their independence. You're promoting the privacy, and you're you're working as partners. Okay. So whenever you're talking about giving care to someone under you, it's all about their choice. It's about their dignity, respecting and preserving their rights. So what are the values in care and support? So professional values of social care. This includes respect, dignity, compassion, improving lives, working together for patients, and everyone counts. Okay. So when we talk about the guiding principles in the NHS, there are 7 key principles that guide the NHS in all that it does. These are underpinned by core NHS values that have been derived from extensive discussions. And these discussions have happened not only with the staff, but also with the public and with the patients. So the public is concerned because the patients, they've been patients or they have been with patients. Okay, so that is why these guiding principles were developed. We'll talk about these. So the NHS provides a comprehensive service available to all. That's one guiding principle. Access to the NHS services is based on clinical need and not on an individual's ability to pay. I'm talking about the NHS service that is free of cost. Okay, so they just your service is based on your need for it. If you don't need it, you will just probably be informed about that. Okay, but if you need it, even if you can't pay for that, you will receive that payment, that service. Again, I'm talking about the NHS services that are free of cost. Okay. The NHS aspires to the highest standards of excellence and professionalism. So if they fall below that, obviously they have check and balances. They're penalized for that. The patient will be at the heart of everything the NHS does. Okay, so whatever decisions they are making, the patient will be at the heart, should be at the heart, ideally. The NHS works across organizational boundaries. The NHS is committed to providing best value for taxpayers' money. So whatever the NHS has to give you as treatment or whatever they're doing, the free of cost thing comes from the taxpayers' money, actually. The NHS is accountable to the public, communities, and patients that it serves.
I want to take.
Hello, I can hear very cute sounds. Yeah, I'm just muting them. Just make sure that you're muting yourself. So it's your own privacy, okay, that we we need to guard all
Mm.
times.
Hello,
Uh,
good morning. I'm
Good
sorry
morning.
about that.
It's okay. It's
Mm,
okay.
okay.
Yeah, it's just a reminder. It happens with myself as well. So I just mute myself as soon as I hear that trigger. So it's we're all humans. Okay. So uh, the NHS has six values. So these we talked about, that we just talked about. These are the seven principles that guide the NHS. However, we have the six NHS values which are working together for patients, okay, and respect and dignity, commitment to quality of care, compassion, improving lives, and everyone counts. So these things that you need to remember, these are basically more important when you're doing your assignment. You need to make sure that these things are involved, these things are part of your assignment, because as we'll discuss tomorrow, what I'll do, I'll go through a very quick recap tomorrow before we do the assignment discussion. So it's a fresh thing for you then, because you've it's been quite a few days that we talked about learning outcome one and then two. So we'll just do a brief overview, and then we'll go on ahead with the assignment discussion. Now I will discuss the core values that underpin social and healthcare service delivery. So social and healthcare service delivery in the United Kingdom, it's underpinned by a set of core values, this core values that we had just talked about. So these guide the provision of care and support for individuals, families, and communities. Okay, so the most important core value is equality. Now we know about terms like equity and equality. Anyone who knows what's the difference between equity and equality? If you can't say it, you can always use this chat box over here. So you can just write things down if you can't unmute yourself. I totally understand. Okay, so there's a difference between equity and equality. If any one of you, if you're free, you can uh, just mention it, what you think is the difference between both. Are they the same? Are they different? And how they are different? And then the principles. So the principle of equality means that everyone should have equal access to healthcare services. And that means it's regardless of their background, of their gender. Does anyone want to say something? Of their ethnicity or other personal characteristics. So this principle is reflected in policies such as the Equality Act 2010, which prohibits the discrimination on the basis of these characteristics. Okay, then we have, so does anyone know what's the difference between equity and equality? No? So what equality is, they've said that you have an equal access, regardless of anything, your background, whatever the determinant factors are. However, equity is not equal. So the older people might have more access, the younger people might have more access, depends upon what the situation is or what access we are talking about. So remember, this is the Equality Act. Whenever you're talking about equality, you should refer to this Act 2010. Then there's person-centered care. Okay, this care places the individual at the heart of the care process, and it takes into account their unique needs, preferences, and circumstances. This approach aims to empower individuals where they can take active role in their care and support, and to be involved in decision making about their treatment and care plan. So respect. So we talked about equality, where we have the Equality Act. This freezes for no reason. Equality, then person-centered care. Then we have respect, partnership, and safety. So respect is the fundamental value in social and healthcare service delivery. And this involves treating individuals with dignity, with empathy, and compassion. This value is reflected, excuse me, in the codes of of conduct for healthcare professionals like nursing and midwifery council code. Partnership is working where it involves collaborating with individuals, families, and communities. So you're not working on your own. The professionals, they are not working on their own. They're working in partnership with all those who are concerned with the care. And this, your main objective is to deliver high quality care and support. This approach recognizes that it is important to involve individuals and their families in the care process and of working in partnership with other healthcare professionals and community organizations. Then comes safety, which is a core value in healthcare service delivery. This involves ensuring that individuals receive care that is safe and effective. This value is reflected in policies and regulations. For example, you have the Health and Social Care Act 2008, which sets out requirements for the safety and quality of healthcare services. So these core values, they underpin the provision of social and healthcare services in the UK. And they are a reflection to commitment to delivering care that is equitable, again, person-centered, respectful, collaborative, and it's safe. Now we go ahead and identify and discuss the ethics that underpins the social healthcare service delivery. So the provision of social and healthcare services within the United Kingdom, it's underpinned by a certain set of ethical principles. And these are there to guide the behavior of healthcare professionals and the provision of care to patients. Some of these principles are autonomy. So that means you have every individual has the right to make their own decisions. This is about their care and treatment. So this principle is reflected in policies like the Mental Capacity Act 2005, which ensures that individuals who lack capacity are supported to make decisions about their care wherever it is possible. Then there's beneficence. Beneficence comes from the word benefit. So this means healthcare professionals act in the best interests of their patients and they promote their well-being. This principle is reflected in policies like the NHS Constitution, which outlines the rights and responsibilities of patients and healthcare professionals. Then you have non-maleficence, which means do not harm. Okay, so the principle of non-maleficence, this requires healthcare professionals where they avoid any sort of harm caused to their patients because of anything that they're doing, their treatment, their uh, their consultations, whatever it may be. Okay, so the principle is reflected in policies such as the GMCs, the General Medical Council's good medical practice, and this outlines the duties of doctors to their patients and the importance of avoiding any harm. So there's some harm that would be there. Okay, so for instance, there's a surgeon who's done a life-threatening surgery and the patient dies because of that. That harm is inevitable, that is there. Okay, so let's say there's that's an emergency C-section. The child might be lost or the mother might lose her life. These things are they're not predictable. Okay, but however, if you can predict, you would avoid any harm as much as possible. Justice, it requires healthcare professionals to treat all patients fairly and equitably. Again, this is what we talked about, treating everyone uh, the same, equal, regardless of their background or circumstances. This principle is reflected in policies like the NHS Constitution, which promotes access to healthcare services for all UK residents. Then there's confidentiality, very important. So this principle requires healthcare professionals to protect the privacy and the confidentiality of their patients' personal and medical information. As we know, we have the Data Protection Act that we adhere to 2018, which sets out the requirements for the collection, use, and storage of personal data. We have all personal data that we store quite often, but that is confidential data that cannot be uh, shared without the patient's understanding and knowledge. Ethics standards. So what do you have? You have autonomy, which is respect and dignity. You have beneficence, which is best interests of the patients. Non-maleficence is not doing any harm or do not harm. Justice is fair and equitable distribution of resources and treatment. Confidentiality is privacy of the individual, and accountability is taking responsibility for one's action. So, overall, these ethical principles underpin the provision of social and healthcare services in the UK, and they reflect a commitment to delivering care that is based on the respect of individuals in regards to their autonomy, the promotion of their well being, avoidance of harm, which is non maleficence, and the provision of equitable and confidential care. So that's about it for today's session. These are all the references that you can look at. For further reading, if you're interested, you can always go to this link. So tomorrow is the day when we are discussing our assignment. I would urge everyone to be there, because if you have any questions, you will be and the lecturer will be there to answer your questions. I'm